Will insurance cover your breast reduction? That's a hard question to answer, but I'll try and kind of summarize some important points regarding insurance companies covering breast reductions. So a lot of insurance companies don't require prior authorization, which is a problem, because what that means is you can't get authorization, you just have to do the surgery and hope that they pay for it afterwards. Other insurance companies do require prior authorization, but prior authorization is not a guarantee of payment. So the frustrating thing about breast reduction surgery is that we don't know whether your insurance company is going to pay for it or not until months after the surgery is done. In general, if you have a documented history of neck pain, back pain, rashes under your breast, difficulty finding bras, difficulty with physical activity, headaches, all the symptoms that excessively large breasts can cause, if that's been documented in your medical record by your primary care doctor for a couple years and conservative measures have failed, meaning losing weight hasn't helped, ibuprofen hasn't helped, special bras haven't helped, if none of it helps, then you may be approved to have your insurance company pay for a breast reduction. But what needs to happen is your medical record needs to reflect a problem with your breasts. In other words, you're having symptoms from your large breasts, and the conservative non-surgical interventions have not relieved your symptoms and have not solved your problems. Then surgical breast reduction may be your solution, and that may be covered by your insurance company. The next hurdle is, do you have enough breast tissue to remove based on your body to meet the qualifications or the metrics that your insurance company has? And in general, this means we need to remove 5 to sometimes 800 grams from each breast to meet the insurance company's requirements to approve payment of the breast reduction. So that's the next step. I'll sit down with you and tell you, hey, based on your body, in your insurance company, we need to remove X number of grams from each breast, which is going to make you, X breast cup size afterwards. Are you okay with that? So that's sort of the next step. And then the next step is we do the surgery, and I talk about the breast reduction, the operation, what it accomplishes, what the recovery is in different videos. But then we do the surgery, we submit the codes in the insurance, in the operative report and everything for payment, and then we have to wait and see if they pay. And sometimes they do and sometimes they don't. So what we do when we do breast reductions through insurance is we have the patients pay the cosmetic rate for the breast reduction ahead of time before surgery. And if the insurance company pays for the breast reduction, we give you all that money back. If the insurance company denies payment of the breast reduction, we're going to appeal it and appeal it and appeal it and do everything we can. The team of coders and billers will handle that. And if in the end the insurance company says it is not medically necessary, we are not paying for this, then we keep the cosmetic payment that was paid ahead of time for the breast reduction. So that is essentially how the breast reduction game is played, because what's hard is there are patients who absolutely functionally need this operation done. It dramatically improves the quality of their life. But the insurance companies don't always want to pay for it. And they don't commit to paying for anything until months after the surgery is done. So that is the breast reduction game. And all I ask is that you all please work with us. Understand that we want you to have a breast reduction. I want you to have a breast reduction. I want you to be happy with your body. I want the symptoms that you're having from your large breast to go away. We all want that for you. But you have to understand that we can't run a plastic surgery practice for free, doing free surgery all the time. And if you have a health insurance company that you pay premiums for, and this health insurance company is supposed to pay for something, they should pay for it. And that's what it comes down to. And so that's why we have you pay the cosmetic rate ahead of time. And if the insurance company doesn't pay, then that covers your cost of surgery. And if the insurance company does pay, we give you your money back. And that's the only fair way to do this. The other thing you can do to help is you can call your insurance company and talk to your human resources department that picked your insurance company and be the consumer on the other end of this conversation. because you are the person that the insurance company wants to keep happy, or your employer is. They don't really care if they keep a plastic surgery office happy. They have no incentive to be fair when it comes to paying for breast reduction in my office, meaning I'm just a single plastic surgeon. They don't really care whether I like them or not. But they do care if your employer or you like them, because you're the one who pays the premiums and gives them money every month. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.